Alyssa Lanham, and I'll be performing a general assessment for the class health assessment for the BSN program at Mercy College of Nursing. So with me today I have Mary, who's going to be letting me do a general assessment on her. And so when we came in, I'm just noticing her gait and her range of motion, looking for any involuntary movements, which was good. All good, range of motion, no involuntary movements noted. We also performed hand hygiene and gathered appropriate equipment. All through this assessment, I'm going to be noticing Mary's mood, her affect, how she's interacting with me. So she seems to be pleasant, has a good normal affect. And so we're also noticing too her skin through the general assessment, and noticing that her clothing is appropriate for the conditions, the weather conditions, which it is. So I'm just going to be starting first with your skin. Do you have any trouble with your skin? Any open areas, any sores, any easy bruising, any troubles? No? Okay, so then we're going to start with the head. So I'm going to be first looking at her hair. Do you have any trouble with your hair? Any brilliance, any falling out? No. All right, good. See, like that. I'm just going to palpate. Next, I'm going to palpate for any lumps or bumps, unevenness. Any tender areas on your head?
No.
Okay. This all seems to be good. So then I'm going to go into her face, noticing first inspection, symmetry of the features. All seem to be symmetrical. Then I'm going to go ahead and move on to palpation. I'm going to notice her temporal artery, which is good. I'm going to notice her, checking for TMJ, so I'm going to have her open her mouth and close. And was that any pain? So that was a nice fluid movement, which is normal, and no pain noted, which is a good thing. I'm going to go ahead and palpate your sinuses, so you should feel pressure but no pain. Okay. Do you have any pain when we're doing that?
No.
Good, good, and that's a normal finding as well. So next I'm going to go ahead and move on to the eye assessment, and I'm going to ask her also when making sure she's alert and oriented. So I'm going to ask her name.
Mary.
Okay, and then I'm going to ask her where we're at today.
We're at Versavilla.
Yes, and also can you tell me today's date?
I don't even know what it is.
What month are we in?
March.
Yep, and in what year?
2015.
Okay, who's president?
Obama.
That'll work. And then why are we here today?
We're here to videotape our assessment so that we can pass our bachelor's class.
Yes, hopefully get our bachelor's. Okay, then I'm going to be moving on. First, I'm going to notice her. We're going to see her corneal reflexes. So I'm going to go ahead and shine a bright light in your eye. I'm going to shine it both. Okay, and I'm going to move on to the other eye. So when I shine her light, I shine it twice, so I make sure each eye is dilating, even the eye that's not being having the light shine in it. Basically, I'm looking for pupil constriction with that, which is a normal finding, and so that is good. And now I'm going to go ahead and move behind you, and I'm going to check your peripheral vision. So I'm going to be moving my fingers, and you tell me know when you can see that.
Yeah.
Okay. Okay, good. So our peripheral vision seems to be intact. So I'm going to go ahead and do the 6 cardinal gazes. So I'm going to have you follow my finger. Okay, so she's following my finger well, which is good. Now I'm going to go ahead and do a cover test. So I'm going to have her look straight ahead. I'm going to cover one of her eyes. Basically, I'm going to make sure that her pupils remain fixed. So I'm going to look straight ahead. Okay, they do. There's no drift noted, which is good. Okay, and then I'm going to go ahead and do... Oh, if I were to be doing, like, checking her vision, like, or acuity, like, her, making sure that I would use a Snellen chart. So basically, I have her stand 20 feet away and read the line that is most comfortable for her. And then notice, see if she has 20/20 vision or better. So do you have any trouble with any reading? Any trouble reading? Alright, now I'm going to go ahead and, now that we did the eyes, I'm going to go ahead and move on to the ears. So first just noticing the ears, noticing their placement, and then noticing do you have any tenderness with your ear, any drainage, any infections, noted? No? Okay, good. And then I'm going to go ahead and move on to palpation. Just kind of feeling her ears. Kind of tugging on them a little bit since I will be kind of tugging on them when I use the otoscope. So for my otoscope, I'm going to hold it upside down with my dominant hand. And since she's an adult, I'm going to pull her pinna up and back. Alright. Alright. And the other side. So I'm just checking the tympanic membrane. So it's like a pearly white, kind of semi-translucent. And I'm checking the ear canal too. I didn't notice any signs of infection or trauma, so that's a good normal finding. So now I'm going to go ahead and do a whisper test. So I'm going to have Mary occlude and one of her ear and release back and forth. And I'm going to whisper a simple phrase and have her repeat it back to me. So just keep occluding and back and forth. Well, yeah, you do it and release back and forth. So like this. Kind of, there we go. I'm going to whistle for a simple phrase. Apple. Now have her repeat it back to me. Did you hear that one? Okay, I'll do it one more time. Apple. Apple. Okay, very good. Now I'm going to do the other side. Do the same thing. Baseball. Baseball. Okay, good. So, do you have any trouble with your hearing? Okay, no trouble. Okay. Any history of that or anything? Okay, good. So now we're going to go ahead and move on to the nose. And we're just basically first just checking the symmetry. Do you have any trouble with your nose? Any infections? Any trauma ever? No? Okay, so just noticing that's good as symmetrical. So then I'm going to take my otoscope once again. And I'm going to look in her nose. I'm going to be noticing the mucosa and the turbinates, and then also just checking for the septum, making sure there's no septal deviation. So I'll have you look back, that's okay. Okay, so there seems that septum's in a good midline, no septal deviation noted, mucosa's good, so all good things. Now I'm going to go ahead and move on to the neck portion of this, so I'm just going to first just look, making sure there's no any swollen nodules noted, any tenderness. Do you have any neck tenderness at all before we start? Okay, good. So now I'm just going to start, I'm going to palpate her lymph nodes. Okay, and I don't feel any lymph nodes, so that's a good thing. And then I'm going to check and make sure her trachea is midline. So now have you lift your head up. So as long as you follow her trachea up. Alright, and then I'll have you swallow for me. Do you have any trouble swallowing at home? No trouble? No coughing after you're eating or drinking? No. Good. Alright, and I'm going to go ahead and try to palpate for the thyroid. So I'm going to stand behind her for this part. So I'm going to have you look up a little bit and kind of over to the side. And then have you swallow. Okay, then I'm going to have you do the same thing with the other side. Okay, swallow. Okay, good. And I don't really feel the thyroid, which is a normal finding. The thyroid really shouldn't be able to palpate that, so we're good with all that. So now we're going to go ahead and move on to her mouth and check all that. Do you have any trouble with your mouth? Any open areas, any soreness, anything? Okay. And then what's your normal dental hygiene routine?
Like every day, brush my teeth twice, go to the dentist twice a year.
Okay, good. So you have regular dental appointments. Yes, good deal. Okay, so I'm just going to have you open your mouth. Okay. Just checking for the teeth and the gum lines here and the buccal. Can I have you put your tongue to the roof of your mouth? So you see the floor of your mouth? Alright, and then stick your tongue out. Say ah. Alright, and look. The hard soft palate, also the uvula. good at midline. All right, so that's good. Now I'm going to go ahead and move on to her. We're going to go ahead and move on to her, check her pulmonary, check all her lungs, fields, and everything. So first I'm going to have her, first I'm just going to check for symmetry of movement. So I'm going to palpate and have her take a deep breath. Take a deep breath. And exhale. Okay, good. And so my hands equally moved up and then back to midline, so that's a normal finding. Oh, I can do it back, it's okay. Oh yeah, let's turn around so we can see on the video. Okay, again. And have you take a deep breath